Does the word diabetes get your attention? Chances are either you or someone you know is dealing with this illness. It is a challenge for nearly 24 million people across this country. Diabetes is a condition in which the body either does not produce enough insulin or does not properly respond to it. Insulin is a hormone produced in the pancreas that affects your metabolism.
It's costly. Over $200 billion are spent taking care of patients every year with diabetes, and it is serious. Diabetes is the leading cause of blindness, kidney failure, heart attacks and strokes, nerve damage, including impotency, and feet problems, including amputations. So it is definitely a serious disease. But the one thing it also is, it is controllable. The patient themselves can control this disease.
Renee Meehan, diabetes nurse specialist with Tampa General Hospital, explains the different types of diabetes and who is at risk for this disease.
There are basically two types of diabetes, type 1 and type 2. Type 1 used to be called juvenile diabetes, and type 2 used to be called adult onset. We've thrown out those terms because we are getting obese children getting adult onset diabetes. And we're getting little 90-year-old ladies getting juvenile diabetes. So we don't use the term with an age in the title. Also, type 1 used to be called insulin dependent, and type 2 used to be called non-insulin dependent. We've thrown those terms out also. It is true, type 1, or the old juvenile type, is insulin dependent. You have to have insulin injections every day in order to survive. However, type 2, to call it non-insulin dependent is erroneous because 50% of type 2 patients are on insulin. The symptoms of diabetes, some people have lots of symptoms and some people have very little. You usually don't get symptoms until your blood sugars are higher than 200, but you're diagnosed with a blood sugar higher than 126. So that's why we have a lot of people walking around with diabetes and they don't know it. But when you do develop the symptoms, you're usually tired, you're thirsty, you urinate frequently, you have blurred vision, you can have stomach pains, you can have headaches, you can have more infections, including vaginal yeast infections and other types of infections. So those are some of the major ones.
Exercise and proper nutrition are key to managing diabetes.
Well, the foundation of diabetes management includes eating properly, meal planning, and exercise or activity. So those are the foundations. All the medicine in the world, all the insulin shots, it's not going to do it if you don't eat right and exercise. Diabetes is a self-managed disease, and because it is self-managed, education is key. We need to teach the patient themselves and their support person how to manage this disease. So we at Tampa General Hospital have a self-management diabetes class, and it is offered monthly. It is nationally recognized by the American Diabetes Association, and it's a great class. It's very comprehensive. It's 2 days. There's 10 hours of content, and we provide lunch both days, and parking is free here, and it's just it's team taught. It's interdisciplinary. We have a registered dietitian who comes and teaches. We have a podiatrist who comes. We have pharmacists. And of course myself, who is a certified diabetes educator. So it's a wonderful course, and I would encourage anybody newly diagnosed or that's having difficulty managing their disease to attend one of these classes. And you just simply talk to your doctor and they write a prescription or a referral to come to the class.
As we move forward in the new year, put your health first. As always, eat right and exercise. For Spotlight Tampa, I'm Carla Kippy.